Now that you have discussed the Medicare program, let's briefly talk about Humana's experience delivering Medicare solutions to members just like you. Humana started in the nursing home business over 50 years ago and have since transformed into a health and well-being company. Today, we serve almost 9 million members nationwide and have contracted providers in all 50 states. We are dedicated to serving members in communities across the country and are focused on helping members achieve their best health. Education Minnesota has designed a specific group plan for retirees. Let's dive into the Rochester plan option. The Rochester plan is considered a traditional PPO plan, which is an abbreviation for Preferred Provider Organization. The Education Minnesota Rochester plan option offers in-network and out-of-network benefits. However, you will experience a lower cost share by visiting providers that are contracted with Humana. We encourage you to use Humana's Physician Finder located on humana.com to find a listing of these in-network or contracted providers. Out-of-network providers do not have a signed contract with Humana, but could still be willing to bill Humana. Your plan does have benefits for using out-of-network providers, but your cost share would be higher than using in-network providers. Regardless of the contracted status of the provider, there are no referrals required on this plan. High level, your plan has no copay for certain preventative care, including mammograms, flu shots, and other annual screenings. The plan has an annual maximum out of pocket, which is a set cap for the most you will pay in the calendar year. Lastly, Humana members that elect the Rochester plan have worldwide emergency coverage when they travel outside the United States. Under your PPO benefits with the Rochester plan option, you have both in-network and out-of-network coverage, depending on the provider's contracted status. Keep in mind, this plan covers all services that would be covered under Original Medicare, but does have a different benefit structure for services. Here are the specifics for your in-network benefits only. First, you have no deductible on this plan, which means you have coverage for services without paying any amount up front. You also have an annual maximum out-of-pocket. This feature is a safety net to your out-of-pocket expenses in the calendar year. The $6,700 is the most you will ever pay for medical services from January to December. The copays and coinsurance that you experience throughout the year accumulate towards this maximum out-of-pocket, and it's quite possible that you might never reach the $6,700 amount. If you do happen to reach it, medical services are covered at 100%. My hope is that the majority of you will never have to reach that maximum out-of-pocket, but the safety net is there ultimately to limit any financial hardship. Outpatient hospital visits are covered from $40 to $250, or 20% of the cost, depending on the place of treatment. Inpatient hospital services have a flat $454 copay for days 1 through 4. When visiting your primary care physician, you will have a $20 copay per visit. Specialist office visit copay under this plan is $50. Outpatient surgical procedures have a copay of a flat $200. And durable medical equipment, which are items such as a wheelchair or CPAP machines or even insulin pumps, those are covered at a certain percentage. Emergency services are covered at $90. And the copay for urgent care, depending on where you seek services, is anywhere from $20 to $50. There are a few additional benefits under the Education Minnesota Rochester plan that are not typically covered by Medicare, including some hearing services, vision services, chiropractic, acupuncture, and podiatry care. For a complete listing of all your in-network and out-of-network benefits, review your EOC, or Evidence of Coverage, which is a detailed plan illustration booklet that is mailed to you after your enrollment is complete. The plan through Education Minnesota also covers prescription drug benefits, also known as Part D benefits. Part D plans are broken out in specific categories, or tiers. Depending on the classification of the medication, it will impact the cost share you experience. Another factor that determines the cost of your medications is whether you get a 30 or 90-day supply, and whether you pick up your prescriptions in person or utilize a mail order delivery system like Humana Pharmacy. With your new plan, you have access to network mail delivery pharmacies, including Humana's owned Humana Pharmacy. Mail delivery pharmacies can ship medications directly to your front door and often remind you when it's time to refill your medications. Using Humana Pharmacy, you receive a variety of different extra services, including 2 pharmacists that check every order that goes out the door to ensure they're safe and accurate. If you have questions, there's a team of pharmacists available and only a phone call away. And as mentioned, Humana Pharmacy reminds you when your prescriptions need to be refilled. They can call you, email, or text you, whichever you prefer. We want to ensure you have an easy experience when getting your prescriptions. Some drugs may be covered under both your Part B and Part D benefits. Coverage is determined by what the drug is used for and how it is administered. Part B benefits are processed under your medical plan, and those typically are covered drugs administered at a doctor's office. Some Part D drugs, however, can be received at both your doctor's office and at in-network pharmacies. Examples of these include your flu and pneumonia vaccines. They are processed under your medical plan benefits. Under your Part D portion of your plan, this is the most commonly used prescription drugs that you're most familiar with filling at the retail or mail order pharmacies. Part D vaccines can be covered differently at the provider's office and at the pharmacy. One example of this is the shingles vaccine. Make sure to get a prescription from your doctor before heading to your pharmacy. Now that we have learned all about the benefits Education Minnesota offers, let's talk about the next step for enrollment. There are multiple ways to enroll in the Humana Education Minnesota plan. You have multiple options available. If you choose, you can enroll over the phone. Call one of our licensed agents today at the phone number listed, 1-800-824-8242. You can also enroll by completing a paper application. After enrollment, you can expect a variety of different mailings from Humana. Let's talk about those and what you can expect. After you enroll in the Humana Medicare Advantage prescription drug plan through Education Minnesota, you can expect to receive a variety of different mailings from Humana. The first is your enrollment confirmation letter. This is verification that Humana has confirmed your eligibility through CMS, or the Centers for Medicare and Medicaid Services. The second piece of mail you can expect to receive is your Humana member ID card. This will arrive in a letter envelope, and it's very non-discreet. Keep a lookout before the first of the year. You will also receive a Medicare Health Survey, which allows you to identify with clinicians or other additional health programs that Humana has to offer. Take advantage of the health survey and get partnered with somebody at Humana today. And the last piece that you can expect to receive is your evidence of coverage, also known as your EOC. This is the detailed booklet that itemizes your health care coverage for your plan. It also includes a privacy notice. Humana's online provider directory, known as Physician Finder, is a convenient way to find a current list of doctors, hospitals, and other healthcare providers in Humana's network. Visit Humana.com to get started. The Humana Medicare Advantage prescription drug plan not only covers your medical and pharmacy benefits, but has an array of extra benefits and resources available for you to take advantage of. Let's talk about a few of those. Humana's group Medicare plans include a variety of extra benefits and resources designed to address all your health needs. From managing chronic conditions to overcoming an acute illness, Humana has the tools available to you at no additional cost. The first is Humana at Home. Humana at Home includes a variety of clinical resources and programs designed to support you in your health journey. These programs are designed to meet you where you need, whether just over the phone or a visit in your home. Different goals and objectives are created for each member, tailoring the experience just for you. Humana Rewards is an incentive-based rewards program, providing actual rewards for members who complete 4 preventative screenings in a calendar year. Members are eligible for a $50 gift card to a variety of different stores or restaurants. The rewards must be redeemed by the end of the year, so I encourage you to get your preventative screenings completed by October 31st. Silver Sneakers is Humana's most utilized extra benefit. This program provides a free fitness membership to a local participating facility, and members can use all of the 16,000 facilities available nationwide. Members have access to the fitness center amenities, including a basic membership, which could include steam and sauna rooms, heated pools, body conditioning classes, strengthening tools, and the exercise equipment and weights. Members also have access to Silver Sneakers classes. Classes are designed specifically to increase strength, balance, and flexibility. My Directives is an online beneficial planning tool, enabling members to develop an advanced directive plan. The tool can collect and ultimately provide instructions to your family members and physicians regarding your care in the event of a medical emergency. Sign in to My Humana to access the My Directives tool. The last is Humana's Well Dine Meal Program. It's providing 10 nutritious pre-cooked meals directly to your front door at no additional cost. This service is available for members following an inpatient or skilled nursing facility stay. Humana recognized that members were receiving an overabundance amount of mailings and other medical insurance statements, so we created the Smart Summary. This mailing encompasses all your medical and pharmacy claims for 1 month and generates one statement, opposed to many statements for each claim incurred. The Smart Summary was designed to be user-friendly and easy to understand and was specifically developed by member feedback. Not only was the Smart Summary designed to illustrate your costs and spending, but the document can also be utilized as a portable health statement and be provided to doctors or other healthcare professionals, giving them a snapshot of your received medical services. After your enrollment in our plan, we want to make sure that we are there for you in case you have any issue, question, or concern. We have multiple ways to stay connected with Humana in order to have the best possible plan experience. We have a dedicated customer care team available for you Monday through Friday, 8 a.m. to 9 p.m. Eastern Standard Time. Please contact us at 1-800-733-9064. Also, there's My Humana, which is an online tool available 24 hours a day, 7 days a week. My Humana is your online resource for personalized health information. You can review your plan benefits, use health or pharmacy tools, or look up costs of prescriptions. You have access to search in-network providers, look at your current drug listing, or print a copy of your ID card. My Humana is your secure portal to access all of your health needs. We appreciate you taking the time to listen to this presentation and encourage you to reach out to us with questions or comments. The dedicated Group Medicare customer service team is available Monday through Friday at 1-800-733-9064. Feel free to explore Humana.com and after your effective date, set up your secure portal through My Humana. And for those that would like their plan benefits at their fingertips, download the My Humana app and have the tools available on your phone or tablet. Keep a lookout for your enrollment kit with further details about your new Humana plan, and we look forward to helping you achieve lifelong well-being.